Thank you so much. Hopefully, is my screen share all right? You can see everything there? Awesome. Okay, hi everyone. I'm Sarah, and this is my Culminating conference presentation. So, my experience in the program and with Island Health's Healthy Public Policy Strategy team. So, before I begin, I would like to acknowledge with respect to the Lekwungen peoples whose stolen traditional territory Yuvik stands on, and the Songhees, Esquimalt, and Wasanic peoples whose relationship to the land continues to this day. Um, Systematically oppressive systems are still present in our educational frameworks, making it critical to understand self-reflexivity, and the unconscious biases that affect the education we receive and deliver within university spaces. So, starting out with who am I and my focus in my Bachelor's of Public Health. My name is Sarah. I'm a community care worker, a lifelong learner, and someone who values involvement in my community. I'm passionate about women's health, poverty reduction, and topics surrounding global health. Throughout the PHSP program, I've been guided by values that continue to shape how I approach my work in population health. Firstly, collaboration across sectors has been a huge one for me, whether with government or community organizations. Working collaboratively leads to more positive outcomes. The program has also emphasized me the importance of interprofessional and multidisciplinary practice, which I experienced firsthand during my practicum with Island Health. And above all, community-based approaches have been foundational to me. Centering the voices most impacted is something that I carry with me into every space I work in. My experience in community care work outside of my practicum and education with PHSP has played a critical role in shaping how I approach public health practice. So my practicum with Island Health Public Policy Strategy and my role as their practicum student. So during my practicum, I had the amazing opportunity to work with Island Health's HPPS team, which focuses on both strategy and public policy work supporting Island Health. I was working to support a wonderful strategy team lead with projects that looked at communication, planning, and topics related to knowledge translation. And my role gave me insight into how policy and strategic direction are shaped internally, which is something I hadn't experienced before, but found incredibly valuable to partner with my other experiences more frontline. So my goals with Island Health's public policy strategy team, my three major goals were to increase my knowledge and understanding of project management skills, as well as navigation of the Island Health portfolio and programs available to the public, as well as increase my understanding of public health research methods. And my practicum ended up leaning much more into the project management side of thing, which I think was very much a weak point for me during my time in education with PHSP. So I was really appreciative of all the support to establish more formal education on that side. So my major projects and tasks with HPPS. The main focus of my practicum was reviewing population and public health's public-facing web content. I conducted an environmental scan comparing Island Health to other health authorities and pulled together recommendations to improve accessibility and quality of service. This project included a formal project plan, a formal project charter, SWOT analysis, and review document. I also helped to design an introduction region context page for the 2025 to 2028 Population Health Strategy Report, as well as did some other tasks to support my supervision and internal language consistency across various teams. I have on this page, here's an example of my program charter. So yeah, I built a formal project charter using Island Health's internal frameworks, outlining the scope, goals, and timelines for my work. This was a first for me and a really great opportunity to practice professional level project planning. It helped me to stay focused, align with team expectations, and deliver something useful and more concrete by the end of my placement. And yeah, we've conducted apologies, just a little, it's not letting me go to my next slide. There we go. Oop, I'll go back one. There we go, perfect. So here is some findings from my SWOT analysis. Island Health demonstrated an incredible amount of strengths and readily available information to island communities. They do amazing work. So these strengths, weaknesses, opportunities, and threats informed my recommendations, and there's some outlined on the screen there for your viewing. So based on this, I was able to provide four more concrete recommendations. First, to have resources readily available for region-specific needs. So for that, populations that are more prevalent in specific regions, ensuring that there's resources available that cater to their needs. Secondly, increased visualization of information and navigation to support wayfinding on the sites. Third, ease in locating community-specific resources. And fourth, to consolidate topics which overlap on various pages. So, development and integration of PHSP knowledge areas. Both my work in community care and my education with PHSP has had an underlying theme related to improving health and reducing health inequities in communities, and a major focus on social determinants of health. In my practicum, HPPS teams value these determinants seriously, and I got to see how they show up at every level, from strategy down to individual tools and language. It was also a big lesson for me in interprofessional practice, how to communicate effectively across teams, manage timelines, and keep my tasks aligned without losing sight of community needs. So now moving on to my key takeaways from the Public Health and Social Policy program. One of the biggest takeaways from my time in the program for me has been the importance of community-informed policy. Strategy needs to reflect people's needs and the people it's meant to serve. I've also developed practical skills like project planning, again, thanks to Island Health as well, collaborative work, and translating research into something accessible. I've come away with a clear understanding of how systems work and how I want to show up in them with purpose and with care, understanding my role when engaging with communities that are not my own. So moving on to my call to action and what's next. So I'd like to end with Truth and Reconciliation call to action number 18, which calls for government to acknowledge how colonial practices continue to impact Indigenous health today. This is a call to action that has shaped how I think about ethical practice, not just in Canada, but in a global context. So following graduation in May, I'm heading out to Malaysian Borneo for a 6-month internship with an organization called Paco's Trust, which is a community-based Indigenous development program. I'm going in with a goal of unlearning and challenging my own assumptions and contributing in ways that are thoughtful and respectful, understanding my role in a context that is not my own, and how to navigate that in ethical and interpretive ways. When I return, I hope to bring that experience into my work within my own collective, being more grounded, more intentional, and moving in with ready to support community-led approaches in ethical ways. So wrapping up, I'd like to say a huge thank you to so many people, starting out with PHSP. I've really enjoyed my time in the program and partnered with my community work. I feel like it's exactly what I wanted to come out with in my education. I want to shout out Jill Dolding, who supported me so much during my time in the program and provides so much kindness and support to so many students. Island Health, I'd like to shout out Sandy Sugarl, my supervisor, who was just absolutely fantastic and provided so much insight to me that I was so happy to soak up. And then the Elizabeth Fry Society and Kanaka Autism Network are two organizations I've worked with for the last 5 years, and I've worked with primarily women at both of these organizations who have really informed how I practice in community care and trauma-informed care, and I think it's really influenced my education and ethics that I hold in my public health practice. And then, yeah, big thank you for listening, and any questions, I'm happy to answer.